The month you were born might be quietly increasing your risk for heart disease, depression, or allergies, and you would never know it. This is not astrology. This is medical data from more than 1.7 million patients. And the patterns researchers found are difficult to ignore. In 2015, scientists at Columbia University Medical Center ran one of the largest medical pattern studies ever attempted. They examined 28 years of hospital records from 1.7 million people. Then they compared every diagnosis with the patient's birth month. The results were surprising. Out of 1,688 diseases, researchers found 55 conditions that showed statistically significant links with birth month. Some risks were up to 40% higher, depending on when a person was born. This does not mean your birth month decides your future. Diet, exercise, and lifestyle matter far more. But the pattern was strong enough that scientists could not ignore it. The reason is something called seasonal programming. During pregnancy and early infancy, the environment changes every month. Sunlight levels rise and fall. Vitamin D levels change. Virus exposure shifts with the seasons. Pollen and allergens appear at different times of year. All of these factors influence how organs develop before birth and how the immune system learns to react to the world. Today we are going through the calendar step by step, starting with the winter babies. January to March, winter babies. The first thing researchers noticed was a clear pattern. People born in the first 3 months of the year showed higher rates of cardiovascular disease compared with people born later. Let's start with January. If you were born in January, studies show a higher relative rate of hypertension, also known as high blood pressure. Hypertension is one of the biggest risk factors for heart attacks and strokes. In the United States alone, heart disease kills more than 600,000 people every year. Scientists believe the reason may start before birth. A January baby spends its final months in the womb during autumn, when sunlight begins to fall sharply. Less sunlight means lower vitamin D production for the mother. Vitamin D is not just for bones. It helps regulate more than 200 genes involved in cardiovascular development. When levels drop during the third trimester, the fetal heart and blood vessels may develop subtle differences that show up decades later as blood pressure problems. Now move to February. February babies are interesting because the data is mixed. Overall, researchers actually found lower total disease risk compared with many other months. But specific conditions appear more often. One example is narcolepsy, a neurological disorder that disrupts sleep cycles. February births also show slightly higher rates of thyroid problems and osteoarthritis later in life. Scientists think winter virus exposure could play a role. During late pregnancy, mothers are more likely to encounter cold and flu viruses circulating in the population. These infections do not necessarily harm the fetus directly, but they may influence how certain organs develop. Next is March, and this month produced some of the strongest signals in the entire study. People born in March showed higher rates of atrial fibrillation, an irregular heart rhythm that can lead to stroke. They also showed increased rates of congestive heart failure and mitral valve disorder. Researchers estimated that about 1 in 40 atrial fibrillation cases may be linked to seasonal effects connected with March births. The same month also showed a slightly higher rate of prostate cancer in men. Scientists are still studying why this pattern appears, but vitamin D again seems to be a key factor. A baby born in March spent almost the entire pregnancy during the darkest months of the year. Even with supplements, winter vitamin D levels are often lower. But here is something important. These risks are statistical patterns across huge populations. They do not mean any individual person will develop the disease. Now the story shifts when we reach spring. April to June, spring babies. Spring babies generally show lower cardiovascular risk than winter babies. More sunlight during pregnancy means more vitamin D during fetal development. But the pattern introduces a new problem: allergies. Several large population studies show that people born in April have a higher risk of autoimmune diseases. These include multiple sclerosis, rheumatoid arthritis, and ulcerative colitis. Researchers analyzed medical data from over 115,000 individuals and found that April births appeared most often among these autoimmune cases. One theory focuses on winter pregnancy again. Low ultraviolet light during the early stages of pregnancy may affect immune system programming in the fetus. Another surprising pattern appears in bone health. Women born in April show a slightly higher chance of osteoporosis, a condition where bones become weaker with age. However, when researchers looked at overall disease patterns, April births still showed lower total disease risk compared with many winter months. Next is May, which many scientists call one of the healthiest birth months. People born in May show lower rates of respiratory infections and generally lower disease risk overall. Some researchers believe the combination of spring sunlight and mild seasonal environments creates ideal conditions for fetal development. Finally, we reach June. June births still benefit from the spring environment, but they show one interesting cardiovascular signal. A condition called preinfarction syndrome, a type of chest pain that can appear before a heart attack, appears slightly more often in people born during this month. The reason is still debated. Some scientists believe early summer heat and seasonal environmental shifts may influence pregnancy physiology in ways researchers are only beginning to understand. July to September, summer babies. Now we move into the summer months. At first glance, summer babies look healthier. More sunlight, more vitamin D, warmer temperatures during pregnancy. But the data shows something more complicated. July births show some of the highest asthma rates in several population studies. That surprises many people. Summer feels like the healthiest season, but the timing of immune development explains the pattern. A July baby reaches 3 to 6 months of age during autumn and early winter. That period is critical because the immune system is learning what is dangerous and what is harmless. During those months, babies are exposed to cold air, indoor dust mites, and seasonal viruses. Dust mite allergens peak between July and October, and these particles are strongly linked with asthma later in life. Researchers believe early exposure during this sensitive window can program the immune system to overreact to harmless particles. However, July births also show an advantage. The Columbia data suggests lower cardiovascular risk compared with winter births. More prenatal sunlight may support healthier heart development. Studies also show that summer-born individuals often have higher birth weights, taller adult height, and slightly later puberty. Now look at August. August sits in what researchers call a neutral zone. Across many disease categories, August babies show one of the lowest overall risk profiles. Late spring and early summer pregnancies provide maximum sunlight during the final trimester, leading to strong vitamin D levels during fetal development. Early infancy also occurs during mild autumn weather instead of peak winter. Some studies show small increases in asthma risk and occasional eye infections, but overall August ranks among the healthiest birth months. Moving on, September births show higher rates of allergy-related diseases, including asthma and respiratory infections. Early immune development happens during late autumn and winter, when viruses and indoor allergens become more common. October to December, autumn and winter babies. According to several analyses of the Columbia dataset, October births show one of the highest overall disease risk profiles when many conditions are combined. Respiratory infections appear more often. Acute upper respiratory illnesses and chest infections show stronger correlations with this birth month. One reason is timing again. October babies spend their first months of life during deep winter, when virus circulation is at its peak. Interestingly, October births also show lower risk of heart disease compared with winter babies. So, the pattern is not purely negative. Some studies even show that October-born children perform better in sports. Being slightly older within school year age groups may give them a physical advantage over younger classmates. While November births show the highest rates of ADHD diagnoses in several large studies, a Scandinavian analysis of more than 900,000 children found that kids born late in the year were significantly more likely to receive an ADHD diagnosis. But there is an important detail. In many school systems, November children are among the youngest in their grade. When teachers compare them with classmates who may be almost a year older, normal developmental differences can look like attention problems. So, Part of the ADHD pattern may come from school-age comparisons rather than biology alone. November births also show higher rates of respiratory illnesses and viral infections, likely because early infancy occurs during peak cold and flu season. However, like October, November babies appear to have lower cardiovascular risk compared with people born in winter and early spring. In the end, December babies show a mix of risks and protections. Respiratory infections appear slightly more often, which makes sense. Early life happens during the coldest months of the year. But surprisingly, December births show lower risk for several major diseases, including some cardiovascular and neurological conditions. One unusual signal also appeared in the Columbia dataset. People born in December showed a slightly higher tendency towards serious bruising injuries that sometimes require hospital treatment. Researchers are still studying why this happens, but overall, December babies often fall into a relatively stable risk category compared with October and November. 12 months. 12 slightly different biological starting points. None of these patterns are destiny. A person born in January can still have perfect heart health. Someone born in August can still develop asthma. The Columbia study itself emphasized that lifestyle factors like diet, exercise, and smoking have far stronger effects on health than birth month. But the research still tells us something fascinating. Before you were even born, the environment around your mother, the sunlight she received, the viruses circulating in the population, the allergens in the air, quietly shape parts of your biology. Those small environmental differences left a signature that may follow you throughout life. The most useful thing you can do with this information is simple. Understand your potential risks. Pay attention to screening. And remember that some parts of your health story may have started long before your first breath. If this made you look at your body differently, you should see what your blood type might reveal about disease risk. The next video is on screen right now, and the science behind it is just as surprising.